Ethics50, Conscientious Objection in Clinical Practice. The patient, Sarah, a 28-year-old woman, presents to your clinic. She is in the early stages of pregnancy and requests an elective termination of pregnancy. The conflict. You, as her physician, have deeply held moral or religious convictions that prevent you from performing or facilitating an abortion. The dilemma. How do you honor your own moral integrity while upholding your professional obligation to the patient's health and autonomy? Ethical guidelines for action. When you find yourself in this situation, your goal is to handle it with professionalism, neutrality, and continuity of care. Here is the step-by-step approach. 1. Maintain professionalism. Do not lecture. The patient has come to you for medical care, not for moral guidance. Action. Acknowledge the patient's request calmly and respectfully. Do not express personal judgment. Do not criticize her decision, and do not attempt to sway her or guilt trip her. Any form of shaming is considered an ethical violation. 2. Declare your conscientious objection. You have the right to inform the patient that you cannot perform the procedure due to your personal beliefs. What to say? I respect your autonomy and your decision, but due to my personal convictions, I am unable to perform this procedure or provide the referral for it myself. Note: ensure you state this clearly and early in the conversation to avoid wasting the patient's time. 3. Ensure continuity of care, the referral obligation. In most medical ethical codes, you cannot simply refuse and abandon the patient. Your duty is to ensure the patient still receives the care she is entitled to. The standard. If your institution or jurisdiction allows it, you must provide the patient with a list of other providers or facilities where she can obtain the services she is seeking. Important. You must not block her access to legal care. You are not doing the procedure. You are facilitating her access to it. This prevents the patient from being stranded without care. 4. Documentation. Document the encounter objectively in the patient's medical records. What to include? Note that the patient requested an abortion, that you informed the patient of your conscientious objection, and that you provided the necessary information/referrals for her to access care elsewhere. Critical do nots for the physician. Do not delay care. Do not intentionally procrastinate in your referral to run out the clock on a pregnancy. This is unethical and can cause medical harm. Do not impose your beliefs. Do not use the consultation as an opportunity to share your personal moral philosophy unless the patient specifically asks about your perspective, and even then, proceed with extreme caution. Do not misinform. Do not provide false medical information. For example, claiming there are medical risks that do not exist to discourage the patient from the procedure. Summary checklist for you. 1. Be transparent. Clearly state your limitation immediately. 2. Be kind. Maintain a supportive and neutral bedside manner. 3. Be professional. Facilitate the patient's transfer to a provider who can perform the service. 4. Stay compliant. Ensure your actions align with local hospital policies and regional laws regarding conscientious objection. Professional tip. Since you are a doctor and likely interacting with other colleagues, keep a list of contacts or clinics that provide these services updated. This allows you to quickly hand over the necessary information to the patient fulfilling your ethical duty to her care while remaining true to your own conscience.